is TotallyT, your solutions girl. This is an interview with Dr. Gordon Elder, a chiropractor out of Texas. We're going to be discussing what are Blair Chiropractors, along with my co-host, Dr. Anita Corrigan. Listen in. Welcome back, everyone. Thank you so much for being here. I am with Dr. Gordon Elder of Lubbock, Texas, joined by my co-host, Dr. Anita Corrigan out of Colorado. Dr. Gordon Elder started young in life when he had an experience with his mother needing upper cervical care. And then later on in life, his young wife was having a lot of problems, and her solution was upper cervical care. And so while he was going to college, he decided to change his major and become a chiropractor, which led to Blair Chiropractic. It's a unique technique, and he's also an instructor. So there are, Dr. Gordon, a lot of chiropractors that still do not know about upper cervical Blair Chiropractors. So can you go ahead and introduce yourself, how you got involved, and why you shifted your direction? Really, we need to understand upper cervical care with Blair Chiropractors.
Sure, absolutely. So when I was 4 years old, I was in a car accident and with my mother. As you mentioned, it started with her. She had been having migraines before the car accident since junior high. But after the car accident, she started having migraines 24 hours a day, 7 days a week. And she eventually, when I was about 10, she started seeing a chiropractor, a regular chiropractor. And she would get a little bit of relief, but it was kind of like an aspirin. It was temporary. Didn't really feel like it was fixing anything. A friend of hers convinced her to try this technique, the Blair technique, which is one of the few upper cervical specific chiropractic techniques out there. And she felt like she was starting to get better. And now she rarely has a migraine. But it took a while for her. She was a difficult case. When I was about 10, about the time she started, I started developing sinus infections that would not go away unless I was on drugs. If I was on drugs, symptoms would go away. As soon as I got off the drugs, symptoms would come right back. She happened to mention it to the chiropractor, and he said, well, he didn't know because he didn't manage or treat symptoms, but he could look and see if there was a problem with the top of my neck and see if that needed to be corrected, and he could correct that. And he did. He found something, he corrected it. My sinus infections went away. So I grew up going to an upper cervical chiropractor from the age of 10, didn't really realize that there were different kinds of chiropractors, didn't realize that not everybody went to a chiropractor. That was just life. With this type of chiropractor, you don't get adjusted every single time. You get a checkup, but if everything's working fine, like it's supposed to, then it's just a checkup. So you see them less and less and less often.
Very good. Very good. And your wife was having some issues as well.
And that's really why I chose it as a career. We got married in Europe and we lived there for a year. And when we came back, my plan was to study business and to get a degree in business because I could pretty much find a job anywhere in the world, I thought, doing that. I was interested in it, but it wasn't exciting. Meanwhile, my wife had some pretty severe health issues from childhood, and she started getting better when I took her to my chiropractor, my upper cervical chiropractor. So that's what got me thinking. I got thinking, well, I'm probably going to have to live next to a Blair chiropractor for the rest of my life, and there's not that many of them, and maybe that would be something I would be good at. And I liked working with my hands. I like helping people. I thought that business would be a great, bring business into it as well. And I thought that would be great. And so I ended up changing my major and moving through chiropractic college as fast as I could.
That's wonderful. I brought Dr. Anita Corrigan. She's an integrative medicine doctor. And so I know that we're going to probably get into some sciencey stuff, and we're not there yet. So when it's time to bring her in, Anita, at this point, do you have anything to say yet?
No, I'm very excited to say that Dr. Elder made a pivot because he saw an imminent need And many people are going to hear maybe something for the first time today. And maybe they've been a purveyor of symptomology medicine, as I call it. And I'm excited to say that there are other options, and I'm excited to see what else you have to bring to the table, Dr. Elder, as I have repurposed myself to bring forth this kind of information so that the consumer can make informed buying decisions on their wellness management.
Thank you, Dr. Anita. And that's the purpose of this whole channel, is because I know of so many different solutions that people just don't know about. I actually met Dr. Elder's wife, Ruth, and we will have a separate interview. So watch for that on this channel as well, so you can hear her amazing story in recovery. And she's now a fitness instructor. That's wonderful. Dr. Elder, I think it would help us to have some visuals. Can you put up your visuals and give us a better idea? Because this is what I understand about chiropractors. I've been to many chiropractors throughout my life, and they always adjusted and cracked it and twisted it and all that, and it really freaks people out if they're not used to it and they don't really know what's going on. But you do things differently, and there's a reason why. So can you share your screen and get us more in depth into that knowledge?
Before I show you some of the imaging that I do in my practice, let me just talk about that. So chiropractic in general has gotten to the point where it's loosening up things to keep people mobile, which is very good. It's healthy. It's something that really helps a lot of people. The question always is percentages. Can I help more people more often with more things? And so we always want to find the source of the problem. Is there one source or many sources? But let's find the root of the problem and fix that and let the body heal itself. The body's a much better doctor than I am. Okay, I'm great at what I do, but really in a sense, I'm a technician, maybe an artist. But in reality, your body is the doctor, and we want to find out, where is it hung up? What is keeping it from healing itself? And the more accurate and precise we can be, the better then we can serve the patient. So one of the ways that we do that is by being very precise in what we see. So an upper cervical chiropractor has a really, really high regard for the neck. And the reason is because all the nerves in your brain have to go through the top of your neck to get to the rest of your body. And the top of your neck is one of the most complex joints or joint systems in the body, neurologically, mechanically. If there's a problem there, it will affect or can affect any other health problem in your body. Doesn't mean it is the main problem, but it can affect it, and it can be the cause. So we want to treat that very carefully, because if you don't treat it carefully, you can create problems anywhere else in the body. So what I'm going to show, go ahead.
Yeah, so when you're saying creating problems, are we talking about nerve and structural problems and pain and inflammation, or could that also lead to problems with different organ function?
That's very good. So I have a chart, which it would have been nice if I had that up, but it kind of gives a tree. And up at the top, you have your brain, and then you have a problem right underneath your brain, and then it's going to create two problems. Number one, it's going to create a neurological problem, which then can cause organ function, brain dysfunction, things like that. But then you have the mechanical problem that is causing the neurological problem, which can be causing other mechanical problems. And then your body reacts to the mechanical problem and the neurological problem by creating more mechanical problems, which then can create more neurological problems. So you could have an ankle problem coming from the neck. You can have a heart problem coming from the neck. You can have an ankle and a heart problem, both coming from the neck. So what we really want to do is find where the primary problem is, fix that, see what the body can fix by itself, see what other areas the body needs help, just getting to the next level where it can take off. The body it's amazing how good of a healer it is. I mean, it's designed to heal. We just got to get out of the way, and we've got to get the minimal amount, give it the minimal amount of help, is I guess what I want to say. Mm-hmm. Let me show you. So
everybody's neck is unique to themselves.
Very good. Yes. So we are all different than everybody else. You're different than your parents. Your right side of your body is different than the left side of your body. So if you just feel the neck and it feels a little bit off or a little bit different, it's kind of like your face. Your face is a little bit different on the right and the left. If it feels a little bit off, doesn't mean it's a problem. It could be a problem. It could be a problem on the opposite side. You might feel like that bone is moved to the left when in reality it's actually moved to the right, but the way you're shaped, can fool you. I've had friends who've gotten sick because they've been adjusted by touch alone. So what we do, let me show you this cool. This is one of the best things that's happened to upper
Well, if it's cool, I want to see it. Okay, got to get my glasses. Right. Okay, I'm back to school now. We're going to school.
All right, so this is, and I'm going to get a little bit more in depth here in a moment, but this is cone beam computed tomography. So a CT scan uses a lot of energy, a lot of radiation, and you can see a lot of things. But dentists use, and now upper cervical chiropractors more and more, use what's called cone beam computed tomography or cone beam CT scans. And these use a lot less radiation, in fact, less than even some x-rays. And they allow us, I get all choked up. They allow us to see people exactly as they're made in 3 dimensions. Now, when you take an x-ray, if you don't take it at exactly the right angle, you might not see something. But if I don't take if I take a CT scan of somebody and it's not exactly the right angle, I can just come in and change it. So right now we're looking at the back of the head. That's up here. Now it looks like this person has a big hole in their head. They don't. That's just where the machine cropped out. Here's the top bone in the neck. Here's the second bone. And that's all we're looking at in this particular picture. But I can come in and I can look from inside the skull down where the spinal cord goes, right down through there.
Oh, wow.
Yes. And I can look at the joints where the where the skull is sitting on the top bone right here and see how it's lined up. I can look at the joints where the top bone is sitting on the second bone. And I usually will take 2 CT scans because these machines are rather small. We can't, unfortunately, yet do a whole body, but I'll take one of the most of the skull and the top of the neck like this one, and then I'll take another one that's got the whole neck on it but crops out a lot of the skull. So this is the most important one. This one shows me the top of the neck, that very complex joint system right up here that is complex both neurologically and mechanically. And I can see exactly how this person is made on the left side, on the right side. I can see what angle these joints are shaped at. So if this bone has moved a little bit in relationship to the skull, I know exactly what angle to come in and slide that bone, exactly what angle to slide that bone back into place so that it takes the pressure off the nerves and allow the body to go back to normal and expressing itself fully. And then it's just a matter of making sure it stays. So some people that's been out of alignment for 20, 30, 40, 50 years. I can put them back into alignment. And I expect that, hey, all the soft tissue in this area, the bones, the ligaments, even the blood vessels and the nerves, they're shaped to that bad, awkward, no good position. And so it's going to take time for the body to remodel. But once we get the pressure off the nerves, the body is going to do just that. And so most of my patients will hold that first adjustment for about 90 days or more. For at least 90 days. That means I'm not having to readjust every time they come in. I'm just checking and making sure that this has stayed in alignment. I do most of my analysis. You'll see over here on the right side, you see that looks more like x-ray. And this is, you see I've got some lines and I'll have some measurements. This 3D is more for me to go back over and look and see, hey, is there anything obvious I'm missing? It's for patients to look at so I can show them what's going on. But we can see so much more than just regular x-ray with this. And if we can see it, then we know how to fix it. If you can't see it, you're guessing on whether you can fix it or not.
Well, I do have 2 questions. When you say slide, I saw you, Anita. I'm sorry, I saw it after I started. I'll come right back to you. When you say slide, a lot of people are just going to go, just tell me if it's going to hurt because I'm not coming if it's going to hurt. What do you mean by slide?
So most adjustments that people are familiar with, not all of them, but there's about 200 different chiropractic techniques, by the way. Most of those techniques, most people, patients are not going to be able to tell the difference. The doctor stresses the joint to a certain point and then puts a little bit more pressure in there. You get a pop. It releases endorphins. It relaxes the muscles, increases blood flow, feels good for a while, loosens things up. That helps keep that joint healthy unless it's done too much. But sometimes getting into that position can be uncomfortable and be painful. Well, because we know exactly how the bone has moved and exactly how the bone is shaped, we do a very light tap. No turning of the neck, no turning of the body. Body's in a completely normal, neutral position. I just come in and give it a really light tap. As long as it's in the right direction, then that will allow the body to slide itself, the bone back into place. Your body wants that bone back into place. It's just stuck. We got to get it unstuck and tell it, hey, you need to go back in this direction, and it will grab it and pull it back. And the better I can do that, the longer that adjustment will hold, and I won't have to repeat it.
I think that this is it removes a lot of fear. People don't like chiropractors or dentists or anybody that's going to hurt them.
Right.
So this is a nice, gentle way, but it's getting to the root source of the problem. And I think through all of your life, and starting in childhood, you did making some little tumbles and falls, or you may have been in a fender bender. It could be something that was very slight that actually started what you had mentioned before. You were talking like in loops, and this affects this. I call that the domino effect.
Yes.
Right. So it could be, like you said, 20 or 30 years later that something has happened. And this is my last statement, and I'm going to mute myself out and let Dr. Anita come back to interview you further. But people can have like high impact sports, like football and boxing. I'm not telling you how to live your life. I'm just saying there's a lot of injuries that once you have that injury, you think, okay, a couple of weeks worth of chiropractic or massages and some anti-inflammatories and ACE bandages, some, icy hot cream or whatever they use, and then they're back to it. But I think there's a danger in that from just what you showed and explained, because there can be a terrible domino effect from that. And I know you do start working with children, which we can also talk about that later. So I think Anita, Dr. Anita, Dr. Elder, I know that you know where I want to go with this. So I'm going to mute out and let you get into the doctor stuff. Go ahead. Continue now on to part 2 to listen in to Dr. Anita delving deeper with Dr. Elder.